How would you briefly describe your project to someone unfamiliar with what you do?
We are providing an 8-week-long nutrition education virtual session for seniors, particularly low-income seniors. And we are working with health profession students to deliver this program. Our intervention was developed with Maine SNAP Ed and has been incorporated in the national SNAP Ed curriculum. And it is tailored to be pandemic responsive and to meet the needs of seniors.
What is the why behind your project?
Seniors' nutrition and health were disproportionately negatively impacted by the COVID-19 pandemic, and this is especially the case for low-income seniors. Universities with health profession students can provide needed services to low-income seniors, and this also is an opportunity for students to learn from working with this population. Our project builds on these mutual benefits so that we can provide nutrition education as well as social interaction with the goal of improving food and nutrition security and improved mental health outcomes.
What has worked well for your project?
So our virtual nutrition education sessions have gone really well. Working with the dietetics program and students in that program has been particularly effective. We find that seniors are feeling comfortable asking them questions, and the students are well positioned to answer questions and provide examples based on their deep knowledge on the subject. We also had an exercise student provide short videos on physical activities that participants could do, and those have worked really well so far.
What are some challenges your project faced?
So far, one of our biggest challenges is recruitment and retention among our population. A lot of medical appointments or health issues have risen up during our sessions. Transportation also seems to be a major barrier to participating, and we have found in general that seniors prefer to be interviewed for the data collection process rather than putting in information on the computers themselves.
How did you find appropriate partners/partner organizations?
We had an existing collaboration between the University of New England and Westbrook Housing. There is a wellness center and community room that is on site at Westbrook Housing that was as a result of a partnership with UNE's Center for Aging and Health. And this partnership was forged by Dr. Thomas Muser. And so UNE provides different health services through this wellness center, and also has a connection with Southern Maine Agency on Aging, who is able to provide meals for the project. UNE is also the statewide SNAP Ed implementing agency, so we had access to a curriculum and nutrition educators through that.
What funding sources have you utilized or will you utilize?
So we have in-kind funding from the University of New England, and we also are receiving support, at least staff support, from Westbrook Housing.
How will this project be sustainable once your grant period is done?
So since Maine SNAP Ed is housed by UNE, we will be able to continue to provide nutrition education sessions throughout the state, and we are hoping specifically with this project to create a toolkit that will help tailor that SNAP Ed curriculum and programs to be responsive to the needs of seniors. And this should be possible given that SNAP Ed is a statewide program and seniors are one of the designated target populations.
What stakeholders do you need buy-in from?
We needed buy-in from the University of New England as well as Westbrook Housing, the Southern Maine Agency on Aging, and the SNAP Ed program.
What advice do you have for trying to replicate a similar project?
So we are really in the beginning stages and are still trying to determine how to make our program as successful as possible, so we don't have any other advice to offer at this time.
How do I get started?
Just pulling all your stakeholders together and brainstorming about how to carry out a similar type of program.
What do you wish you would have known prior to beginning the project?
So we wish we would have known some of the barriers to using technology with this population and how to better collect data by using laptops rather than tablets.